So what we're going to do is look at locking. And when we lock, we can lock from above or below. When we're pulling on the arm, and what we're going to do is pull on a bottom arm to create a side bending. So if he's laying on the table and I pull on his arm, it's going to pull him and pull it up. It's going to pull him into side bending on that side. If I pull the arm down, the side bending is going to go the other way. So this is the bottom arm on the table. So we're going to use that arm either pulling it up or pulling it down. If I take this arm and put it like this, while I'm pulling up, it's going to bring him into extension. If I take this arm and put it forward and pull up, it's going to bring him into flexion. So we can bias flexion, extension, and side bending based on how we pull on the arm. When he's laying on the side of the bed, he's always going to go back. So if he's laying on his right side, he's always going to have left rotation as a component. So when we're doing the lock and we're bringing it above his head and we're bringing him into side bending, that's side bending left, left rotation, we call that an ipsilateral lock. If I'm pulling him into contralateral side bending, so I'm bringing him into right side bending, he's still going to have left rotation. So that's a contralateral lock. This facilitates closing, this facilitates opening. So just by altering the arm position, you can either open or close. For our manipulation purpose for this TL junction, I like to use the closing lock or the ipsilateral lock. It just works better. I like to show it in standing so that you can see what's going on in the upper part. The lower part's pretty easy to show in side lying. So now I'm going to have you lay on your side. When we're doing the lower locking, we can do extension or flexion. And then we can do side bending to open or side bending to close. So we pull the bottom leg to bring the pelvis this way for ipsilateral side bending, or the top leg to pull down for opening. We use this for our stenotics, and we'll use this to get a good lock when we manipulate, or we'll also use it for our chronic discs, which we'll talk about, and we have talked about. In review, the reason why we lock from above and below, biasing flexion, extension, and side bending, is that there are sometimes you go to put a patient in a position and they find it uncomfortable. So let's say that I'm bringing the patient into flexion and I bring him into this side bending and they're like, oh, that feels uncomfortable. Okay, well, the component I was working on was flexion and ipsilateral side bending, but that was uncomfortable for them. So maybe I can keep the flexion component, but take away the side bending and go side bend the other way. And they're like, oh, that feels so much better. Okay, so I'm taking the stress off the segment. So then I'm permitted to be able to go through and use that form of locking. We can thrust also from above and below. If you have a super hypermobile segment, you want to avoid a lot of thrusting from below. You want to bias your top hand from above. We teach that in some of the later levels.